We are continue into chapter 3, part 2, which focuses on the legislative and judicial process and the Surgeon General. The legislative and judicial process. Public health law has become more complex over the years, but it follows a standard pattern. At any level of government, legislature perceiving a need passes a statute. That statute may be challenged in court, and the decision of the court may be appealed to higher courts. Generally, on issues of constitutionally, a state court may overturn a local law or court decision, and a federal court may overturn a state law or court decision. In the next slide, I will explain where administrative agencies fit into this process. The role of administrative agencies. Since public health increasingly involves complex technical issues, legislatures at the several levels of government generally set up administrative agencies to perform public health functions. The legislature, recognizing that it lacks the necessary expertise, authorizes these agencies to set rules that define in detail how to accomplish the purpose of the legislation. The courts may then be called on to interpret the authority of the agencies under the laws and to determine whether certain rules or decisions of an agency are within its legal authority. In the next slide, I will provide an excellent example of agency rulemaking through OSHA. What is OSHA? OSHA means abbreviation of the Occupational Safety and Health Administration, OSHA. As an example, consider the Occupational Safety and Health Acts passed by the Congress in 1970. This legislation used the federal government's authority over interstate commerce to pass a public health statute. The law established the Occupational Safety and Health Administration, or OSHA, as I mentioned, within the Department of Labor. OSHA was authorized to set standards regulating employees' exposure to hazardous substances. Representatives of industry challenged the constitutional authority of Congress to pass the law but were unsuccessful. However, industries found other ways to push back. For example, OSHA decided to regulate benzene, which caused toxic effect among workers in the rubber and petrochemical industries. In 1971, OSHA set a standard limiting benzene exposure to 10 parts per million in the air. Based on epidemiological evidence, in 1978, yes, uh, OSHA lowered the standard to 1 part per million. Industries appealed, claiming the evidence was not strong enough and compliance was too expensive. The court agreed that OSHA did not have sufficient evidence, and the standard remained at 10 parts per million until 1987. The courts also determined that formal cost benefits analysis was not required under the law, though costs and benefits are usually considered together. Now that we understand the legal framework, let's explore the actual organization of public health, starting locally. The local public health agencies. The organization of public health at the local level varies from state to state and even within states. The most common local agency is the, the county health department. The large city may have its own municipal health department, and rural areas may be served by multi county health departments. Keep in mind, some local areas have no public health department, leaving their residents to do without some services and to depend on state government for others. Local health department have the day-to-day responsibility for public health matters in their uh, in their uh, jurisdiction. What exactly do these local agencies do? The responsibilities of local health agencies. These daily tasks include collecting health statistics, conducting communicable disease control program, and providing screening and immunization. They provide health education services, chronic disease control program, sanitation inspections, and school health programs. They also deliver maternal and child health services and public health nursing services. In many states, laws assign local public health agencies the responsibility of providing medical care to the poor, a role that tend to consume excessive resources. How these local agencies are funded. The sources of fund of local health department activities vary widely among states. Some states provide the bulk of funding, whereas others provide very little. The federal government may fund some activities directly or pass funds through the states. A portion of the budget usually comes from local property and sales taxes and from service fees. The extent to which local health departments are responsive to state and federal mandates is likely to depend on how much of their budget is provided by those sources. When funded when funded locally, Agencies must continuously educate the city council or county legislature about the importance of public health. Okay, state health departments, the core duties. States have the primary constitutional responsibility and authority for the protection of health, safety, and general welfare of the population. And much of this responsibility fails on state health departments. The scope now, the scope varies. Some states have separate agencies for social services, aging, mental health, and environment. The separation can cause a problem if agencies do not consult each other. The state health department may set policies to be followed by local agencies, coordinates their activities, and collects and analyze their data. There are two major specific duties of the states. State health departments are usually charged with licensing and certification of medical personnel, facilities, and services to maintain standards of competence and quality of care. Furthermore, people who lack private health insurance are generally the concern of state health departments. Some of these people are covered by Medicaid, the joint federal state program for the poor. States have significant flexibility on how to administer the Medicaid program, determining eligibility rules, and setting payment amount for doctors and hospitals. Funding for state Funding for state health department activities comes mostly from state taxes and federal grants. Now let's look at the top level, the federal to introduce the federal agencies. Federal agencies in the public health. Most traditional public health activities at the federal level, other than environmental health, fall under the jurisdiction of the Department of Health and Human Services, or WHS. As you can see on the organizational here, the organizational agencies, the predominant agencies under the the health and the human services uh, are the Center for Disease Control and Prevention (CDC) and the National Institute of Health (NIH) and the Food and the Drug Administration, the FDA. Now we are going to discuss regarding the Surgeon General. The Surgeon General is the nation's leading spokesperson on matters of public health. The position doesn't itself carry much direct line authority, but it holds a great moral authority. For example, the role became very visible in the 1980s uh, when the coup spoke out with great courage on the politically controversial subjects of AIDS and tobacco use. Let's discuss the CDC. CDC is the centers, again, this is the Centers for Disease Control and Prevention. The CDC is the main assessment and epidemiological agency for the nation. Its mission is to control and prevent human disease. The CDC is staffed with epidemiologists who travel throughout the country and the world to detect outbreaks of disease, to track down the causes of epidemics, and, and also to halt their spread. It also has laboratories at its headquarters in Atlanta. Additionally, one of its office is the National Center for Health Statistics, which is the national authority for collecting and analyzing health data. The CDC mission has changed over time. Traditionally, the CDC focused on infectious diseases. However, the CDC has expanded its mission over recent decades to include chronic diseases, genetics, injury and violence, and environmental health. This involvement is more controversial politically in that it embroils the agency in discussions of health related behavior as well as of industries such as tobacco and firearms. The CDC also issues a weekly publication called Morbidity and Mortality Weekly Report, double MWR. In fact, the very first published reports that uh, heralded the onset of the AIDS epidemic appeared in the WMWR on June 1981. Now let's go to discuss the NIH. NIH, the National Institutes of Health. In contrast to the CDC crisis oriented operation, the NIH holds a longer view as it functions as a research agency. The NIH is the largest biomedical research complex in the world. It provides grants to biomedical scientists throughout the United States and has its own clinical center in in different area, a research hospital where medical researchers test experimental therapies. It also houses the National Library of Medicine. The NIH, the National Institute of Health, has enjoyed strong support from the United States Congress over the years because research aimed at curing human diseases is a popular cause. Now I will going to discuss our the final major WHS agency, the FDA, Food and Drug Administration. The modern FDA was established in 1931. Current law provides for the agency to evaluate all new drugs, food additives, and colorings and certain medical device, approving them only if they are proven safe and in the case of drug effectives. The agency also regulates vaccines and diagnostic tests, animal drugs, and cosmetics. Because FDA regulation affect major segment of the United States economy, this agency frequently comes under attack, either for being too restrictive or when an approved product is found to cause harm or being too lenient. Other federal agencies also play a role as EPA. EPA, the Environmental Protection Agency. Other components of the WHS include the Center of Medicare and Medicaid Services and the Indian Health Service Agency, which operates hospitals and health clinics for Native Americans. Outside of WHS, the prime agency focused on the environmental is the Environmental Protection Agency, the EPA, established in 1970. It carries out a program dealing with water pollution, air pollution, and toxic substances control. The EPA is one of the most controversial federal public health agencies and has often been attacked by Congress. Even departments outside of health and environmental have public health rules. Many other federal agencies have public health responsibilities. The Department of Agriculture oversees food and nutrition programs include food stamps and school lunches. The Department of Education supervises health education and school health and safety program. The Department of Transportation responsible for traffic safety. The Department of Labor has OSHA also. The Department of uh, Veterans Affairs administers its own health and medical services, and the Department of Defense provides medical care for the armed forces. Finally, the Department of Homeland Security was created in 2003 to protect the public from act tourism, natural disaster, and other emergencies. To wrap up our system overview, I will discuss the non-governmental actors. The non-governmental organization. While government bears the major responsibility for the public health, many non-governmental organizations play important roles, especially in education, lobbying, and research. Organizations that focus on a specific disease, such as the American Heart Association and the American Cancer Society, lobby Congress for resources and policies to benefit their causes. A professional membership organization, uh, professional membership organizations such as the American Public Health Association and the American Medical Association are also active in lobbying. However, the American Medical Association is also known for its opposition to some public health related programs, such as the government sponsored insurance option in President Obama in 2009 health reforms plan. The conclusion, collaborative effort. To conclude, public health is primarily the responsibility of government, although successful public health enterprise must involve all sectors of the community because the United States Constitution doesn't mention health. The states have the primary legal responsibility for public health. In terms, local government as the level of governments closest to the people provide the bulk of public health services. Despite the lack of explicit constitutional authority, the federal government has established a significant presence in public health by establishing laws on national national issues and using its authority to tax and spend. This is the all of this today, and this is the end of the chapter 3. Thank you for your attention. See you next chapter, and goodbye.